Here we go.
Hi, we are the Centricycle social venture. I'm Carrie Urena, and these are my teammates, Alex Tina and Nabil Salka. Before we get started, let me tell you a brief story of a young woman in Gujarat, India named Geeta. Geeta is 22 years old and in her second pregnancy. She has lately been feeling giddy, tired, and weak, but assumes these are normal symptoms of pregnancy. After all, many of her friends suffered the same thing. As the symptoms get worse, she realizes this may not be normal, but what can she do? The nearest healthcare center is over 20 kilometers away. Her and her husband are unwilling to take the risk to go there when they don't know if the hospital can help or if anything is even wrong. The loss of days' wages and medical costs are more than they can afford. Her only option is to continue on and hope that it passes. Geeta is fictional, but her story is shared by hundreds of thousands of women in rural India. What she endured was called anemia, a problem with a lack of red blood cells. It can be dangerous during pregnancy, often because the mother doesn't have enough energy to sustain herself and her child. It can also be detrimental in young children as well, stunting emotional, mental, and physical development. It is often easy to cure with mineral and vitamin supplements. However, it's still one of the world's second leading causes of disability. The problem is in lack of diagnostic tools and education, which is where we come in. We have created a hand-powered centrifuge made up of bicycle parts. Centrifuges are necessary in order to separate blood into different components as well as urine so that tests can be run. One of these tests is called the hematocrit, which can diagnose anemia. Our device is designed specifically for these developing locations. It's accurate, affordable, and sustainable. So our original business plan to distribute this device was to create a small parts package in order to aid in construction, as well as a picture manual to bridge language barriers. We would sell these things to NGOs who would then distribute them all around the world. They would build them, maintain them, and be the general network for them in different developing country locations. In order to test this and other hypotheses, we decided to talk to different people. The main hypotheses we had were that our device would be a platform for a wide variety of diagnostic tests. NGOs would be able to distribute our device and in any location where it would be culturally acceptable. Now, coming through this, we came across a couple roadblocks and had a couple key pivot points. So, the people we talked to were in three main areas. They were in the technical, the business, and the cultural implementations of our design. We talked to people such as NGOs, student organizations, doctors, professors, people in India who had implemented similar devices, as well as people who had been to rural clinics and had experience there. The key pivot points I mentioned, the first of them was that NGOs had no incentive to work with us. We had to make them have an incentive. We had to pick a cause and location so that we could help them out while they were helping us. The cause we decided on was anemia for many of the reasons I mentioned before. It has a huge addressable market need of over 818 million people across the globe. Then we decided on India. The reason for this is India has a huge market need. It also has a wide supply of bicycles, which is necessary to build our device, as well as we have contacts there already. In short, we also decided we had to be based in India. This is so we could create that network to make our device efficient and actually be able to work. We could build customer relationships and trust that way. In short, we've come a long way from our original business plan.
Thank you, Carrie. Our design distinguishes itself from competitors in that it has been designed specifically for the Indian demographic. Our device is sustainable in costing $20. It's also, is affordable in costing only $20 and is also sustainable in that it's made out of bicycle parts. And India is the second largest manufacturer of bicycles in the world. Further, our value proposition includes strong customer relationships that our venture could build. We hope to operate completely in India in order to create those. We have decided on the following customer segments. We will be selling to NGOs who share our vision of improving the quality of rural health in India. Additionally, our business plan will be centered around the needs of clinicians, who will be the end users of our device, as well as patients, who will be the ultimate beneficiaries of the centrifuge. Our current business plan is customer-centric. Centricycle will establish strong customer relationships by holding an office in India that will contain consultants who will work with the customers in order to build and sustain the centrifuge. We also hope to work with local universities, like the Mahatma Gandhi Institute of Medical Sciences, in order to conduct field testing and receive feedback from clinicians who will be using our device. Then in the United States, we would revise our prototypes and conduct further testing in order to make a centrifuge that best meets our end users' needs. Also in the United States, we hope to apply for intellectual property as well as fundraising. In addition to fundraising, Centricycle sees its revenue coming from the $20 price of the instructions manual and parts package we will sell to NGOs. Also, Centricycle will collect revenue from maintenance and insurance fees that come with the centrifuge. We see our cost coming from the $16 price of the cost of making each centrifuge, as well as employee salaries, and the cost to create an office in India in order to hold our consultants. Though the cost may seem high, after extensive research on the demographic of India, Centricycle has concluded that our total addressable need is 202 million people. In order to create social change in the lives of these 202 million people, Centricycle sees itself improving the quality of rural healthcare in their individual communities. But our social our social impact does not stop there. We will also educate patients by allowing them to know the extent to which they are suffering from the disease, and also when to receive treatment. Additionally, the centrifuge will allow NGOs to better target patients because our centrifuge will be able to distinguish those who have anemia from those who don't. And lastly, people like Geetha will no longer need to travel to an urban center to receive health care and could save a day's wait by receiving health care locally. In addition to the social impact, Centricycle sees an economic impact. This economic impact has been based on a study conducted at the University of Toronto that stated that $3.2 billion is lost every year from India's GDP as a direct consequence of anemia. When our device is implemented, we hope to greatly reduce this deficit. In addition, the study asserted that for every dollar invested into projects that hope to minimize anemia, $36 is returned to the country through increased productivity of the workers. Now I'm going to turn it over to Alex to discuss competitive landscapes.
Well, as Nabil mentioned, one of the main factors where our device excels in terms of competitors is affordability. So our main competitor in India is, of course, electric centrifuges. And so electric centrifuges are the industry standard. It's the go-to device if you want to separate blood. And all the medical tests are standardized around the results from the medical centrifuges. So what we've done to address this and further excel our device and to top this competitor is develop a calibration card of our own onto which the hematocrit can be simply evaluated visually through a simple card. And another reason why we beat the electric centrifuge is because of the reasons listed up there, where they cost often over $1,000. As Nabil mentioned, ours is only $20. So that's a huge margins of savings for NGOs and the government agencies. They're made of these highly specialized parts, and if they were to break down, there is no alternative for maintenance in India. If the electric centrifuge breaks down, that's it, you're done. Another competitor would be chemical diagnostics. And what this entails is simply placing a drop of blood onto a sheet of paper or a similar strip, and then as some sort of color indicator, for example, would show the presence of a protein or indicate that anemia is present. Problems with this, however, they are almost always single use and it's disposable, so it in no way is sustainable. They're not going to have a supply of these on hand to continuously diagnose anemia. However, we also saw this as a great partnership because included in our parts package, as Carrie was describing, we could include these rapid diagnostic tests, since many of these suppliers, the blood that has to be placed on these strips requires centrifuge blood in the first place. So we could benefit greatly from a partnership between both companies. Breezing through a couple other competitors, clinical inspection simply involves the doctor looking at the patient and seeing how pale they look. And as you may imagine, it's not entirely accurate. However, it is very inexpensive. It costs nothing, but it does require the trained doctor, which is not available, and it doesn't work on adults because the children's skin is the main issue of how we look at that. And finally, other manual centrifuges that are out there, they have similar value propositions to our own. However, the picture shows the main point, essentially, is that they have very low sample sizes. Two blood samples per spin is simply not going to cut it in a developing clinic, while we can do up to 90 capillary tubes per spin, which is obviously very favorable, as well as the same problem with the electric centrifuge, where it's made of highly specialized machine parts, and if something were to break down, there's nothing they could do. So as Nabil went over our current business plan, we've developed three new hypotheses that we've distilled from our 5 milestones that we would like to get working on to help launch our business. So those can be divided up into our first one, which would be to finalize the beta prototype. And what that entails is doing continued human blood testing beyond the initial but promising work that we've already done, as well as building an indicator device to show to the operator that it's completely done, you can stop spinning. Because as it is currently stated, it's simply a time issue, and we would like to make that more user-friendly. To continue, identify more partners and customers, and that's because, like I mentioned with the rapid diagnostic test, we would love to work more with them instead of the anemia focus, because that would be a direct business partner that we could work with, and we would benefit greatly from each other. And a promising contact we've made already is MedImpacts, which is a supplier of these diagnostic strips. And so the big thing that we're really looking to do would be field testing. And since we are such a customer-centered, network-based startup, we need to go to India, and we need to talk to all 3 levels of our customer segments in person to collect actual feedback, not secondhand from medical students that have been there, as we're currently doing. And to get that, obviously, we need funding, and we would love to do that at the end of the semester is what we're planning to do. So in closing, we're back to Geetha and her family, and through Centricycle's vision, she has been able to get help for her condition in a locally available setting through use of our device, and through the diagnostic, seek help from which was otherwise an undiagnosed disease, and give a name to what was affecting her. And we really hope for you guys to help join us in this, and thank you for your time, and we'll love to answer any questions.
All right.